Hello friends, today is February 3rd, 2026, and a little update on my cancer journey. I recently got my Signatera test back, the blood test, and it is negative once again. So rolling into this new year with zero sign of cancer, which is wonderful. Feeling really good about that. Last year at the end, it was in December, I was able to finally track my cycle and get a Dutch test done, which the Dutch test is a really great hormone testing test. It also can look at other metabolites in your body, but what it really shines is how you're breaking down your hormones in your body and whether or not you're even making those hormones productively at all. It also looks at cortisol and how you're metabolizing cortisol. So the Dutch test is a very unique test. It's a tricky test to time if you have an irregular cycle, which I am regularly irregular, and not bad. It's nothing terrible, but not, that 28 perfect day cycle like many people. So it's been tricky to time because anytime I think I'm within that like day 19 to day 22 range, you only get a couple days range to test yourself for this. I've missed it. Either I'm traveling or this whole last year I had survival school and pelviology classes, and I've got another course coming up. I'm gone this weekend to volunteer to help clear out for the survival school prepping for next year. I'm just there to chop wood and help clear the paths, but it'll be a good kind of catch up with some of the alumni of that group and get to nerd out in the woods for a little bit. And then after that, I fly out to Dallas in March. I've got Pelviology 3 coming up. So I've got 3 courses in Dallas this year, and I'll probably, I'm sure, stack a few more into my schedule. But it was wonderful to be able to do this over the holidays and really track this and get this test done, because I have been trying to do this for over 2 years now. Even before my cancer diagnosis, I just had a hard time making it work. You have to have everything kind of counted out, and then, you just got to be ready. And I never really pulled it off. And it's a common thing for women trying to, and men can do the Dutch test as well. But it's a tricky thing to time if you have any kind of cycle irregularities, which is, why this information is so handy to sort of break down what's going on and why. I highly recommend the Dutch test. It has given me some information I have never seen before. And I really liked the overlap to understand why some of these things are happening in my body when I compared it to my Nutrition Genome Test, which I did last year, which is that very extensive testing. I went over it in one of my YouTube videos. Very extensive testing on my genome, and really got a great look into some of the metabolic issues I've had in my liver, and it has given me a lot of background and understanding on why maybe I ended up developing the type of cancer I developed, which is important so that I understand how to make sure I minimize that risk moving forward. Not trying to have a recurrence of cancer. That's no good. And just trying to really understand these pathways as well as I can. This is especially important for women who are dealing with hormone positive or ER/PR positive, or one of those positive, it doesn't matter. But if you're dealing with an estrogen or progesterone positive type cancer, I really think understanding some of this background story of how your body's metabolizing and working through some of these pathways is crucial, and it is a really overlooked thing. My oncologist did not recommend this. I've been trying to time this with my acupuncturist, who's probably still one of the best lab readers I've ever seen. She's excellent. She always has a really unique angle to take from this. And so, you just have to have somebody on your team that knows to recommend these kind of tests. They're not all that difficult to get, and they're not all that expensive. But I think they are game changers. So if you're dealing with a type of cancer out there and you're in remission or hoping to get into remission and avoid a relapse, which is very common in ER and PR, ER positive or PR positive types of breast cancer, super common that comes back. And I hypothesize that it's probably because a lot of people aren't looking at these kind of tests and really breaking down what's going on in your body. How well are your organs working together? And what are you doing in a stress state? Are you able to make these pathways work properly, or are you causing DNA damage or growing cancer? Because there are pathways that, you know, are well known and well studied to be linked to cancer in general. And yeah, and I just think, unfortunately, a lot of our testing out there does not understand hormones, not even just women's hormones, men's too, but everybody has estrogen in their body, whether you're male or female, and it is one of the most complex molecules, I think, at all, ever. So it has a lot of opening, revolving doors, if you would. If that molecule is not working properly or is misunderstood, like I think a lot of our testing is, you can really get confused, and it seems like your body's attacking you. And I do not believe my body wants me to have cancer. I don't believe that my body is saying, you're just, you know, you're programmed to terminate at this age. That's just wild to me. There's too many other things out there out of our control, as far as, you know, what's in the air, the water, our food, all of that off the table right now, which I'm sure leads to a lot of this as well. In diet's important too, but there are things in your genome that can cause some of these buildups. So anyway, without further ado, what did I find out about me? So some big things to note is, the first thing my acupuncturist said to me was, if I didn't know you better in your case, I would look at this and think that you were a post-menopausal woman. Post-menopausal. If you don't know me really that well, I'm 39 years old. I'll be 40 in July. I might be in the pre-menopausal range, but I certainly wouldn't have expected to be in the post-menopausal range. And basically that's because when you look at my hormones in general, they're all just tanked. Like, they're really low. Progesterone, incredibly low. Yeah, not great. And estrogen as well for me is pretty darn low. Like, in, again, the postmenopausal range. I'm not going to show you this. I'm trying to not like put stuff up on YouTube that you can maybe get personal information out of. So I want to show this stuff, but you can look this up. It breaks down how this should look. I'll probably show a few little pieces here, but like, you know, as far as estrogen goes, you have an E1, an E2, and an E3, and these go through different pathways, and they can be recycled, right? And they also can be not moved out of your body properly. So if they're not, and they get like reuptake, anyway, taken up by the body again, they can end up blocking and binding receptors that were meant for active estrogens, and these are sort of like spent estrogens. So if that's the case, not great, not a great thing. For those of you that are dealing with estrogen-dominated cancers, it is important to incorporate flaxseed. So far, that's what I've learned is a pretty good binder for estrogen. It will bind to the used estrogen and pull it out in your stool. Obviously, get whole seed and then grind it up yourself. You have to grind it, because if you just have whole seed, it's just like any seed, it's just going to pass through your body. But so far, what I've learned about flaxseed is that it's pretty amazing at binding to estrogen and pulling it out of the body. So that is one way you can kind of clear it out of your own body. There are other things. People will use DIM. I started using DIM in the beginning of my journey, and it's not that I was doing so many things. It wasn't like I was like, oh, that DIM is really making me feel terrible. No, I didn't really notice that, but it just didn't seem intuitively like something I wanted to be utilizing. And yeah, like, and again, I have a HER2 positive cancer, ERPR negative as far as my biopsies. So I think intuitively knew this is not for me, and I don't need to dampen my estrogen production. In fact, I probably maybe need to get a little bit more, but estrogen is a real hot topic as far as cancer. And I do think there's a different conversation when you're talking natural hormones versus synthetic hormones. I think most of the studies that have been done that find estrogen to be cancerous is coming out of the synthetic hormone research. You have to be really careful with that stuff. That is not natural to the body. Again, estrogen is a complex molecule. It has a lot of pathways it opens up and closes down. So you can't, I just don't think we can make it in a lab and it be matched for our body really properly. So estrogen's a really important deal to make sure you are metabolizing. And there are 3 different pathways that are talked about for the most part. I'm sure there may be more out there, and they don't always go into full explanation of this stuff, and we probably don't even know all of this. But a really big one that people should know and that you need to know, and it's a protective pathway, is when E1, the first estrone, goes through CYP1A1. It's a protective pathway that takes E1 or estrogen 1 and it brings it down into the 2-OHE1. And I'm aware that nobody really cares about these letters, but some people do. So that is a very protective pathway. So dropping it into the 2-OHE1 pathway is a really good pathway because it helps pull it over into the liver and it starts to get methylated. So I can show you that little portion. So there's E1. I'm pretty low, and it goes down into this form, which is going to be the 2-OHE1, and it looks like I'm doing okay. I'm on the higher side, which is good. This is a protective pathway, and then it goes over into this methylated pathway, which if you follow this little line, ooh, I'm pretty low over here. I'm tanking out. I'm on the very low end of the methylation pathway, which is obviously hinting that I have some methylation issues, and I'll get to that. The E2 and E3 levels, pretty low on those too. You can just see how bottomed out I am on these, and if you want to look, these are the progesterone, pretty dang low for somebody in 39, but I've been through a lot, so who knows. So E2 and then E3. And then if you can see these pathways, see there's a red pathway here and this blue pathway. The red pathway is the CYP1B1, CYP1B1, and that's dropping into the 4-OHE1. This is not a good pathway. This is a pathway that causes, well, I can't say it's a bad pathway. It is what it is, but this pathway can cause DNA damage if you don't methylate or detox properly. So you need to have good glutathione levels, good methylation. And so the problem with this pathway is it binds to your DNA and damages it. So that's not a good pathway to have, relying on in the body. And then there's this other pathway coming over to this guy. You can see it's also pretty bottomed out, which in my case is a good thing. That third pathway, the 16-OHE1, this is the one that grows cancer. So the good news is I'm pretty low on that. So that's great. So I'm not really running those pathways. The cancer risk goes up a lot if you're taking your estrogen and you're metabolizing it and it's going into these other pathways. That's just really clear that you are high risk for cancer. You should know about this because there are things you can do to help support those pathways. So luckily, I'm not dealing with a lot of that stuff, but my problem comes into the methylation, the COMT and the MTHFR. So these are really important markers, and unfortunately, I have multiple. I think I have 2 in each of those. So 2 COMT, COMT, and MTHFR. People call that a lot of things, but it's a pretty not fun marker because it means that your body is not metabolizing or methylating your B vitamins properly. And if you're not methylating your B vitamins, there are a couple routes it can take, but one of them helps or ends up creating a lot of homocysteine in the body, which is very inflammatory, and that can be creating heart disease of all sorts. So not great to have a homocysteine level on the high end, which I have taken a B complex for a long time, since grad school, since I learned about how important these water-soluble B vitamins are. I have taken a B complex, and I've also happened to take a pre-methylated B complex, which is great. I'm really grateful I had done that. I think I've helped support my body as well as I knew how to at the time. That was one supplement I've never regretted taking. However, turns out because of the this other test I learned about the genome, the nutrition genome, I learned that I need very specific forms of like B9, folinic acid. I'm very sensitive. Folinic acid is a much more appropriate bioavailable B9 for me. Hydroxycobalamin is another really gentle form of B12. Some people need these. Just really important to know, because if you aren't getting enough, or it's not enough, let's see, if you're not using all of them, or you can't even convert the Bs into what you need, then they're helping out maybe a few pathways here, but you're losing them over here. And that's a big deal, because Bs can have a lot to do with your mood, your ability to break down neurotransmitters. So yeah, so that's a big deal. And then the COMT marker that I have 2 of those markers, just indicates that I'm slower at methylating and breaking down different, let's see, sorry, I'm getting ahead of myself, neurotransmitters. So some of the COMT I've got is going to be a slower breakdown of dopamine, adrenaline, and estrogen. So the COMT situation in women, and it's pretty well researched, but there's more research to be done on COMT, is that if you have a slow COMT, you can't take certain supplements, like things that have quercetin, which quercetin, I have mentioned in previous videos, has been like my savior when it comes to anything with mast cell activation, which I do tend to lean toward. My body has a really big overreaction to like bug bites, poison ivy. It's like I just can't get rid of it. Even if I get the oil off, it doesn't matter. My mast cells are like, oh, nope, irritation, and they just keep inflaming the area. The only thing, and I have tried a million topicals, I even did some homeopathic clears, which some of that stuff seemed really helpful, but nothing was really immediate. The only thing I've ever noticed that was immediate was when Dr. T had consulted with another doctor, I believe it was Naisha Winters, who's a big name in the cancer world. She said, try quercetin and take a high dose, like 2,000 milligrams, which is a really high dose of quercetin. But sure enough, I did it. I did it 3 times in a day for a few days there, but literally overnight. I think I did it twice before bed. It was like I woke up and the inflammation had just gone down so much. I didn't have that redness. Like it was game changing. It makes me feel like I have something in my arsenal to attack what my body is attacking, to like stop my body from overreacting. So quercetin is something that I am going to keep in my medicine cabinet. I will use it. I just won't use it every day. I think some of these things can be really helpful, but everything in the proper dose, right? So the same thing goes with EGCG, which a lot of people say if you have a COMT marker, you shouldn't have green tea, or EGCG, which I don't believe, because there's other markers in my body that say, oh, you should have green tea, that'll help you. So it goes back and forth. I think it comes down to like maybe not having an extract that's super strong and trying to rely on that. Maybe just do the green tea, and just don't like concentrate it down and try to dose that. That might end up creating it slows the COMT pathway even more. So that could be a problem. And so other things with COMT is if I'm also having an issue metabolizing estrogen, which luckily seeing this, not so bad. Not so bad, just the methylation issues I have. You can do, oh gosh, I've got myself a little excited about it. Yeah, you can do green tea. You just can't be doing like anything that's super high dose. And you want to make sure that you're also taking enough magnesium, which I have upped my magnesium, because some of those things are going to also help me clear these metabolites faster, these neurotransmitters faster. But it also explains, the COMT marker explains also why sometimes I get kind of revved up about something, and it's very challenging for me to like come down from that. Like, anybody who knows me or has hung out with me, if you've been around me when I've gotten worked up about stuff, which is fairly common, a little less common these days, but I used to really rev myself up, with just the injustices of the world, and I'm taking on the weight of the world, and all of the things that really upset me about the things in the world. And it was very hard. It's always been very hard for me to like put my feet back on the ground after I'm like, it's just not fair, and like, and just get so angry and revved up. And and I thought that was just how people are, but no, it turns out there are reasons why I can't break those neurotransmitters down. I can't calm or reduce my stress levels as effectively as you'd think, or somebody who's processing these things better should be able to. So just knowing that has been really helpful for me. So I try to avoid getting myself caught up in a lot of that stuff. I don't watch the news, which I never really got into that, but I've really stepped away from keeping as involved as I once did, because I'm sure we only get part stories anyway. And I think a lot of the stuff out there in the social media world, which I do a pretty good job avoiding, I think it's there to rev you up. I think it's trying to, pull out some kind of emotional response. And there's sort of this need to like keep everybody in this like highly charged emotional, world. And I think it's a very big distraction on the things that maybe we need to be focusing on, like nature and breathing and the things we overlook, eating properly, all that stuff. So anyway, it's very encouraging to see test results like this that are like, oh yeah, well, you thought you had a problem there. Boom, you do have a problem there. So if you're out there and you're like, wow, my test results are the same as hers, what do we do? Well, I don't know yet, but there's a few things I have been adding to help these processes along. I am going to do another Dutch test, hopefully in the next couple months. After there's another test my acupuncturist is going to have me do where she's testing me every day of my cycle, which is going to be even more specific and break this down even better, just in case we slightly miss the window. It's a small window that you're trying to hit between that day 19 and 22. I was on the latter end, so it's possible that I just caught that portion of the cycle and it was already on the lower side. It doesn't mean that I am like super deficient in progesterone or estrogen or any of these things. I could have just been hitting a different portion of that cycle. So it is good to do these again. Plus, I have a chance now to take some of these supplements, do some of these things, and see if it changes. So some of the things for my methylation, and I have mentioned them in the previous videos, have been to make sure I'm taking the proper B vitamins, which check, doing that. I need to make sure I'm taking enough of them. So specifically B6, 9, and 12, very important for this metabolic discrepancy. One of the really big ones I added is TMG, which is betaine. Betaine is basically like a B complex or a B vitamin. I think it was like B8. I think that's what it used to be known as, was B8. Because, you always see these B complex numbers and you're like, oh, that's weird. There's like B1, 2, 3, but there jumps to 5 and then 6 and then jumps over 7 and it goes to 9. And where is 8 and 7? And anyway, betaine used to be known as B8. And so also known as TMG, which is like the trimethyl glycinate. It's basically a glycine molecule, but this is a pre-methylated form of glycine. Glycine, a lot of people need glycine. It's one of those that is super important. So if you don't know if you have a methylation issue, you maybe should look into glycine, do a little research on that. It's important anyway. But if you do have a methylation issue, you may end up needing more betaine. And you can get betaine from beets. And there's a few other vegetables, but beets, that's where the betaine for beet, like betaine. I call it betaine. It could be betaine, whatever. It doesn't matter. So it originally is coming from beets. A lot of people take beets and the beet powders, and some of that stuff is amazing. Some of it's super fake, so you have to like do your research. I used to eat just enormous amounts of beets. Like I ate so many beets. I wasn't even sure if there was blood in my stool or it was just the beets. I don't know. I ate them almost daily. And beets aren't bad or anything. They're, any kind of starchy vegetable like this has its pluses and minuses. I think I overate them because they were just a really easy, inexpensive vegetable I could buy and I could feel satiated with. I did a lot of sweets and beets. I don't eat as many beets now because of the sugar content, though I still like them. I just don't include them in all of my things, and it's probably nicer because I can like regulate my stool better and have better readings on that. But yeah, TMG. So that's one of the big ones I had to add, and it should help push up the dial on this and improve the methylation activity that I've needed. I've also added a few different forms of magnesium. I do citrate. I try to do that 2 to 3 times a day. So magnesium citrate is very important to make sure that, you know, some of your, what am I thinking? Just say ions, I guess, are headed in the right direction. So if you have, you know, if you have like calcification of soft tissue, people often think, oh, that must be not enough K2, which is important. Vitamin K2 is very important for that and to the direction of where those ions need to go to calcify. But magnesium citrate is another really important one. If you're deficient in magnesium citrate, you can end up developing kidney stones. And I have noticed on the past, I did a lumbar MRI, gosh, probably 2019 or so, maybe 2020, I don't know. I did an MRI that showed that, yeah, I was looking at my spine, but I noticed in my kidney, my left kidney, I had an enlargement there. It looked like kind of a cyst forming or formed. And I noticed a spot that lit up, and so that was bone. So I basically have a little kidney stone started in my left kidney. And so I have treated those in the past a little bit, but I know I need more magnesium, so I have upped my citrate. I've also, with that, pulled up my potassium citrate because we need an insane amount of potassium daily. It's super overlooked, and it's hard to even get enough because the FDA regulates how much they can even put into things, and there's a whole thing there. But I have increased both of my citrate forms, so magnesium citrate and potassium citrate. You just can't go crazy with the magnesium citrate because it can upset your belly. So I keep it around 400 milligrams or a little lower a day. And I also have been doing glycinate in the evenings, which is really good for leg cramps and irritation there. So I do the glycinate, and then sometimes I'll throw in the malate form throughout the day. And another one is threonate. I'll sometimes do that. The threonate, magnesium threonate, can go through the blood-brain barrier, or they say it can go through the blood-brain barrier and be helpful for the brain. So I toss that one in there too sometimes. Other things that are important to perhaps throw in is because my liver already has multiple detoxification issues. And again, I saw a few of these things in my genome test. I have a couple big issues with my liver, you know, not being able to absorb choline very well. I've got issues with making and holding on to enough D. So there's a lot of these things that are like, oh yeah, this could cause cancer if it goes long enough. Another thing I've kind of added in then is the SAMe, which I do not do SAMe. This is a liver support. I do not do it daily. Some people do. I've listened to a lot of different sort of opinions or advice about this. I remember doing a ton of research when my miniature schnauzer was dying of liver. Who knows? I never had a biopsy done. I didn't want to put her through that, but liver something, because she was very jaundiced, and she ended up getting ascites toward the end, and we got rid of it 3 different times naturally. And then I started having to have a vet come and drain her. It was very sad. The whole thing was absolutely terrible. It was right before I started chemo. It was one of the reasons why I probably delayed my own treatment, but we do crazy things for our fur babies. It's just the truth of the matter. But I read an entire book about liver health for dogs, and you know, I'd known about SAMe as far as like my biochemistry classes in grad school, but I ended up using a little bit of SAMe. I would do it like every couple days. I front loaded a little bit, so I added it daily a little bit in the beginning, and then I like did it every other day or every couple days for her with milk thistle, which I also do every day. Very helpful for the liver. And I mean, it really, really helped. Like, she really turned around for a while there. I never got 100% better, but she was seemingly having a better quality of life, which was very important for me and my partner at the time. So yeah, SAMe was another one that I've kind of thrown in the mix just to see how I feel with that. And there is some cool stuff about SAMe in depression. There's a lot of interesting research tying that to being perhaps even more effective than antidepressants and safer to take long term. So again, some people take this every day. Some people rotate it like I do. I feel like most things, it's just kind of smart to rotate it, give your body breaks. But I think it's different per case, per person. But yeah, I am very intrigued on the antidepressant side because, you know, what if what if a lot of people's depression are the basis of indicating there's a liver issue, there's a detox issue, there's a methylation issue, there's a COMT issue with breaking down neurotransmitters. There's so many layers in the body. The body is super complex. So yeah, I just wonder how much of that maybe is being overlooked because people either don't have access to the proper tests or just didn't know anything about them. Yeah, who knows? So yeah, SAMe. And the last thing I want to just mention is they also test cortisol. And so they'll look at cortisone and then how it converts to cortisol. And for the most part, my levels are right in the normal. I'm like right in the middle part of the peak. So like, you get a certain bump of cortisol first thing in the morning, and then 2 hours after waking, you're usually at your highest level of cortisol, and then it, tapers down throughout the day, and then hopefully it's at its lowest part before bed. Some people are all over the board with the cortisol stuff. Mine is interesting. I'm pretty much dead center except the 2 hours after I'm slightly higher. So it's like I wake up and my cortisol's like, and which makes sense. I'm a morning person. I like to get up and do stuff in the morning. I feel fairly, not always motivated, but fairly motivated. I feel like I need to move. I can't just lay in bed too late. And that's partly why I'm feeling that is because my cortisol is on the higher side. So one thing that was recommended is to maybe add in some Tulsi tea or lemon balm to help take that kind of edge off. I already have decreased my coffee, not that that necessarily blows your cortisol out of the water, but I usually do 1 cup of coffee and then usually like a decaf from there. But I haven't cut the coffee out again. I have done that in the past, but I personally, I'm enjoying the coffee, and so I'm just going to let myself enjoy the coffee. I do it black, so it's not the worst thing in the world. And I like my coffee, fancy coffee. So with this, they look at the metabolized cortisol and then the, free cortisol. And one thing to notice is that my dials are pointing in the opposite direction, which is not ideal. That's not great. So I have a decent amount of cortisol on the high end. It would say for the 24-hour free cortisol, I'm like right up to 200. But then the metabolized cortisol, I'm dropped down to just about, it's the lowest part of the limits of what's in the healthy range. So usually what that indicates is the cortisol clearance rate is on the low side. I'm having a hard time clearing it. And so that could indicate a thyroid issue, which does make me think there could be some thyroid stuff playing in. When I earlier, 2024, when I did my PET scan, they had noted that my thyroid was lit up and inflamed. And of course they were like, oh, there's cancer in your thyroid. Well, no, there wasn't actually cancer in my thyroid. But there was inflammation, and whether that was because of the mistletoe I had been doing, which does cause some inflammation of the body, it's not a bad type of inflammation, but that's how it works. I was wondering if it was anything to do with that. I should also note that this was noted in the CT even before. So my CT did notice some thyroid activity, and that would have been before I started mistletoe. So I already had some inflammation going on in there. And you can see I don't really have like, nodules or anything. That's just my thyroid cartilage, but I've watched and I haven't noticed anything with my my thyroid, but some of the genome tests did indicate that I could be having some issue, like a associated higher level of T4, which does tend to make you more sensitive to pesticides and PCBs, and it might indicate I need a higher level of selenium and zinc, which I have been tested for selenium in the past and my levels were good. I take zinc periodically. I've got little lozenges I'll suck on, so that feels like a good thing for my immune system. But I think my next move is to start to test my thyroid. So if you're having issues like this, it's important to make sure that you're testing your TSH, your thyroid stimulating hormone. And then often what's poorly tested or missed completely is you have to ask for the reverse T3, which is pretty important because you can get this masking effect of T4 to T3. So you want to ask for the TSH, the reverse T3, and then also the free T4, T3. So you want to have more than just saying like, oh, do you have good T4 or T3? Yeah, but like, what's the conversion? It's the T3 conversion that's so important. Is that happening properly? And then when I do these tests, which I'll probably do in the next couple months, I'm also going to test my homocysteine again just to make sure that my B vitamins are holding up and doing their job. And then I'm going to also test the iodine and probably selenium again just to double check back in, because I was eating Brazil nuts in the beginning of all this and I don't eat them that often at this point. So I'll check in on my selenium. But the iodine is one thing that often in the alternative health world, some people are like, everybody should just take iodine. It's super important. We're all very deficient. And I'm sure that a lot of us are very deficient in iodine. I used to eat a lot of kelp and seaweed, which is still, it gives you decent iodine, but it's not enough. So I take kind of a low dose iodine right now, but I'm waiting. Hopefully this company out of Europe will get this iodine over to me. It's a pretty concentrated dropper form. And I was hoping after I get this tested first, because I'm not trying to just take it just because you can overstimulate your thyroid too. So you don't want to like swing the thyroid. Testing is probably the smartest way to know if you should be on a supplement at all. But I am looking to hopefully add a drop or two of iodine in the morning and just see if that will help my thyroid convert and hopefully help clear this cortisol. So that's going to be the big stuff that I'm focusing on. I hope you guys got a little something out of this. If you're looking to do the Dutch test or a nutrition genome test, you can find them online. There's plenty of practitioners out there that read these and order these for you. There's plenty of videos that go into depth on all of these sections of this test. So I am just sharing my information. This is not what everybody's going to see on theirs. But it is very important to understand, how your body's metabolizing, and especially if you have cancer in your family or you are dealing with cancer. I think this is one of these avenues that gets overlooked, right? You're free of cancer, Janine. You're all done. Go live your life. That's it, right? That's what, a lot of people probably assume that I've just been like, great, I've beat it and I can just go about living my life however I want. Well, no, I could. I don't want to go down that pathway again. I don't want to be in that position again. I want to approach this as intelligently as I can and squeeze out as many good years I've got. And I think, knowing more is never a harmful thing. The more information you have, the more these dots start to connect in time. So hopefully you're feeling empowered and you want to take control of your own health and do some of this testing or have somebody do this testing for you. I think these are really important avenues to help people stay healthy and thrive and not just survive. Looking for thriving here. So I hope that was helpful, and thanks for sticking into the end, and I'll catch you guys in the next month or so. Take care.